The blood supply of the brain is a complex and highly protected system made up of two main sources, the internal carotid arteries and the vertebral arteries. These arteries travel up from the neck and meet at the base of the brain to form a critical arterial network known as the Circle of Willis. The Circle of Willis acts as a kind of traffic roundabout, allowing blood to be redistributed if one of the main arteries becomes blocked. This design will allow blood to come from another direction, providing an extra safeguard to the brain's blood supply. From the Circle of Willis, three major arteries branch off to feed different parts of the brain. The anterior cerebral arteries supply the medial surfaces of the frontal lobes and the superior portions of the parietal lobes. The middle cerebral arteries, the largest branches, supply the outer portions of the frontal, parietal, and temporal lobes. Finally, the posterior cerebral arteries, which arise from the vertebro-basilar system, supply the occipital lobes and the undersides of the temporal lobes. The clinical importance of this layout becomes clear when we consider stroke syndromes. For example, if someone has a blockage in the right MCA or middle cerebral artery, which is the most commonly affected vessel in ischemic strokes, they will likely develop weakness or numbness on the left side of their face and arm, and they may also experience difficulties with language or spatial awareness depending on which hemisphere is dominant. In contrast, a stroke caused by vertebral artery dissection, meaning a tear in one of the vertebral arteries that run along the back of the neck, usually affects the posterior circulation of the brain. This can lead to dizziness, double vision, problems with balance, or even locked-in syndrome if the basilar artery is compromised, leaving a person awake and aware but unable to move anything except their eyes. While the arterial system supplies oxygenated blood, the venous system is responsible for draining deoxygenated blood from the brain. Unlike most of the body, the veins in the brain do not run alongside the arteries. Instead, blood is collected by superficial and deep cerebral veins and then channeled into reservoirs called dural venous sinuses. The most important of these sinuses include the superior sagittal sinus, the straight sinus, the transverse sinuses, and the cavernous sinus. All these venous channels ultimately drain into the internal jugular veins, returning blood to the heart. The anatomy of these venous sinuses is not just a matter of plumbing, it has real clinical implications, particularly when it comes to infection. There are important connections between the veins of the face, nose, and ears and the cavernous sinus. Because these veins often lack valves, infections from a danger triangle area of the face, like a boil near the nose or an infected pimple, can spread backward into the cavernous sinus, causing a rare but life-threatening complication called cavernous sinus thrombosis. Similarly, untreated ear or sinus infections can also reach the brain through these venous pathways, potentially leading to meningitis or brain abscesses. In summary, the brain's blood supply relies on a dual system that provides some redundancy and protection through the Circle of Willis, but blockages in certain arteries can lead to very specific stroke symptoms depending on the affected territory. The venous drainage system, while efficient, can also act as a highway for infections to spread from seemingly minor areas on the face or head to the delicate tissues of the brain. Understanding these pathways not only helps us localize and diagnose neurological symptoms, but also highlights the importance of treating infections early and recognizing the signs of stroke as true medical emergencies.